every day now. Very much fun.
Welcome to Seasoned Citizens Present. My name is Bob Carl, and our guest today is Dr. Henry Tack, who is a podiatrist here in Muscatine. And he tells me he's been here since 1955.
Right.
And we're very pleased to have you, Doctor, and to give our viewers the benefit of some information on the care of feet. And since you are a podiatrist, I think maybe you ought to explain what that term is, what it means.
Okay. The word podiatrist means someone that works on the feet. P-O-D is for feet, pod. And we take 3 years of pre-medical training, and then we go to a podiatry school. And then our podiatry school is for 4 years. Then after podiatry school, today, many of the podiatrists take a residency in a hospital somewhere for a year or 2 or 3, depending on the program they're in. And we take care of most anything on the feet. We do surgery on the feet. We do orthopedic work on the feet, and probably the most popular thing we do is corns and calluses. We work with those, and ingrown toenails, and that's pretty much what a podiatrist is.
I see. Well, I wasn't sure. I knew of the care of the feet, but I didn't know how much of the surgery aspects of this. And I know there are a lot of deformities and lots of problems that occur in people's situations that create problems. And I can't think of anything that's much more uncomfortable than having sore feet, so I can sympathize with anybody who has some problems. And I think this is particularly true as we grow older and have some problems. Do you want to?
Right. Yes. Our feet have a little difficult situation in the fact that they're the furthest of our body from our heart. So they do develop circulatory problems much more than other parts of the body. The other thing is that our feet normally are down on the floor, so they have the blood to get back from the feet, have to fight gravity. So you need a little bit of force behind the blood to get it back up the feet. And as we get older, the blood vessels and the heart may not work as well as they used to, so it's not unusual to have some vascular problems in the feet. When it comes to vascular problems, there's really two different things. One is the arterial system, the one that runs the blood down to the feet. There can be many problems with that. And then there's the venous problem, which the blood comes back up to the heart through the veins, and we get things such as varicose veins and a lot of different vein problems too that can create a problem. I think that one of the things that we want to talk about today is probably just general care of the feet. I think it's important for older people because of the circulation problems they have and some nerve problems that they're aware that they can hurt their feet very easily. And one of the things they have to stay away from is real hot water on their feet. A lot of people think that the hotter the water is, the better it is, but that's not true. You can really do some harm to your feet by having them in hot water. So we usually recommend that they soak their feet in comfortably warm water and not real hot water. The other thing that they have to do, usually it's a little more difficult to get to your feet. I like to think that as we get older, our legs get longer, our feet get a little further away from us, but it is a little harder to get to your feet. But it is important to examine your feet, look between the toes and on the bottom of the feet. And one of the things we suggest to people is that they could use a mirror to look at the bottom of their feet if they can't get their feet around, or if they have someone else around to take a look at their feet. Probably the thing that we probably would like to speak most about today would be diabetes, because there are over 2 million diabetics in the United States over 65 years of age, so there's a lot of them. And of these 2 million, 400,000 of them have diabetes seriously enough that they are going to have foot complications. And there are going to be between 12 and 15,000 amputations of parts of the foot, or all of the foot, or part of the leg. So it's very important for the diabetic particularly to pay a lot of attention to their feet. One of the things as we get older, and with diabetics also, is that the skin gets a little dry, and it's easy to get a little crack on the skin and get an infection in there and have serious problems. So we recommend that they use some type of a cream on their feet, keep their feet dry, be sure to dry after bathing or soaking your feet well between the toes. Sometimes it's real easy just to run the towel over the feet, but you should really run the towel between the toes and keep those dry. And during the day, if you have any moisture problems, powder between the toes and the bottom of the feet. Then in the evening, you should wash off your feet every evening, and then cream them before you go to bed. And then the next morning you powder them again before you put your shoes and stockings on.
Well, I've noticed sometimes if I don't do a good job of drying between my toes, they become irritated, and I've occasionally in traveling you pick up things from some of the places that you're staying, like athlete's foot and some of those things that can really be difficult.
Right. Yeah. Athlete's foot or a fungus on your feet is quite common, because you can get fungus infections anywhere on your body, but the feet are the most prevalent place to have a fungus problem. And fungus likes moisture, and it likes darkness, and it likes warmth, and those are usually the things that you have on feet, you know.
Yes.
Fungus cannot grow in the air, so it normally gets into the skin, or on the feet. A common problem is fungus toenails, which is difficult to get rid of, because the fungus keeps growing into the nail as the nail keeps growing out. And so it's important to try to prevent these things, you know, by keeping your feet dry and clean. And so that's what we think you should do. Give your feet as much room as possible in the shoes. We'll speak maybe a little bit about shoes.
Yes, I think that would be good.
Yeah. I know that a lot of people like to have their shoes off, including myself, but it's not a good idea to walk around without any shoes, because it's easy to step on something, or it's easy to get something in your foot. We see quite commonly just maybe animal hair or some hair from the carpet that gets embedded in the foot, and then it can cause a little abscess.
Is that right?
Yeah.
I didn't know that.
Yeah, and so, you know, it's good for that reason. It's also good because we see a lot of broken toes, and
Yes.
we call them bedroom toes because you get up at night and walking around, and the next thing you do is jam a toe against a piece of furniture, and it's very easy to break the toe.
Mm.
The shaft of the bones in your toes are about the size of a pencil, and it doesn't take a great deal of force, you know, to fracture those. So
Yes.
that's a pretty painful thing. So when it comes to shoes, I think that what you have to do is not be so particular about what size the shoe is. The way to fit a shoe is by trying on the shoe and see how it fits your particular foot, because sometimes the style of the shoe or sometimes the make of the shoe, the size may vary a little bit.
Mm-hmm.
So I wouldn't be too much on what size it is. You know, that's a good place. The reason shoe people measure your foot is to give them an idea of what shoe to start with, at least, you know, try
Sure.
on.
Kind of a benchmark.
Yeah, right.
Uh-huh.
And if you're going to be on your feet any to speak of, you should really wear lace shoes because the laces really support your foot by tightening up the counter of the shoe and to hold the heel or the rear of your rear foot. The other thing is that as we walk, we have a tendency to be pushing our foot forward in the shoe all the time. And if you can lace the shoe up, that has a tendency to keep the foot back in the shoe
Mm-hmm.
and not tighten on your toes as much. When it comes to a dress type shoe, particularly for the ladies, I always say, you know, wear whatever seems to be kind of comfortable to you, and try not to be on your feet too much when you're wearing a dress shoe.
Mm-hmm.
But have a shoe for every day, for working and walking. And while we're talking about shoes, I'd say that the jogging type of shoe or walking type shoe is a very fine shoe, because they've done a lot of research for joggers to make them more comfortable for them. So it turns out to be a pretty good shoe for them.
Mm-hmm.
So,
I've wondered, it seemed to me, I used to have some foot problems. Mine in particular was perspiration, and of course over time that's resolved itself. But I think somebody told me one time you're better off if you wear a different pair each day, if you can do that,
Mm-hmm.
because that gives them a chance to air out,
Right.
and so that the moisture isn't
Right.
isn't contained in the
Right.
shoe. And
right. And that also leads to the fact that we should always wear stockings. There are a lot of people that like to go around barefoot in their shoes. That's not a very good idea, because particularly if you have some cotton or wool in the stocking, that absorbs some of the moisture off of your feet. It acts like a wick that pulls the moisture off your feet. The other thing is the powder that we talked about, powdering your feet. Of course, that absorbs some of the moisture. Then the moisture doesn't sit on your feet so much.
Uh-huh.
And the other thing is for irritation, friction that you get on your feet. We have to remember that when we take a step and lift our foot up, all of our toes go up in the air because that's the way we lift our foot. If you notice someone walking barefoot, each step they take, their toes flex up. And you have to have a little bit of motion be able to have a little motion in your shoe. So we constantly are moving our toes around in the shoe, so we do need that extra room, and we need something to cushion it a little bit.
Mm-hmm.
Now, when it comes to things like nylons, which the women wear, they're not as absorbing, and they're, of course, not as much of a cushion, but that's the style today. And
Mm-hmm.
So they're wearing them, but they're not as good for your feet. So.
I've wondered, I've noticed people, and it seems to be more typical of people who are on their feet for long periods of time. People who work in manufacturing plants that wear white stockings as opposed to a colored stocking. And is there anything there that I presume it's the dye in the stocking that they're trying to avoid?
Yeah, right. There are some people that are sensitive to some of the dyes, and the other thing I think about white stockings is that people may not wear them quite as long.
Well, that's
because
that's true. They show the soil, don't they?
Yeah, right.
Yes, that's true.
And of course, we should be sure to change our stockings every day and keep them clean as we can. But
is wool better? When I was having all my problems, everybody has these home remedies, that they like to try, and I got all kinds of advice. Well, you ought to be wearing all wool, or you shouldn't be wearing all wool. You should be wearing cotton. Does that seem to have any impact?
I think it kind of depends. Of course, wool would be warmer, and if your feet are warm to start with, probably cotton might be better.
Might be a more sensible choice.
I think that either one of those, either cotton or wool, are fine. It's difficult today because nylon makes the stocking wear so much better, so almost all stockings have some synthetic fiber in them.
Yes.
And so it's difficult to get all wool or all cotton unless you go to like an athletic sock, which is white.
Yeah.
Normally.
Yeah.
I think one of the things that I'd like to talk about too that I see a lot of, and that is people that have heel pain. A lot of people are concerned about the fact that they may have a heel spur, and a lot of people do have heel spurs, but the pain that a person gets is not from the heel spur. The pain the person gets is from an inflammation they have in the heel, which that inflammation in turn irritates the bone and creates the heel spur. But the reason people get these is because of the posture of their feet when they're standing is not what it should be, and maybe not what it used to be, and so then they get a strain on the heel bone, and this inflammation and a painful heel. One of the things that leads to this is the fact that the shoes do not hold their foot in the right position, and a lot of times it's people that aren't wearing shoes. That's another reason for wearing shoes.
For wearing them.
Yeah. And but that's a common foot problem, is what we call a plantar fasciitis. It's a ligament that runs along the bottom of your foot and attaches onto the heel bone. And when you pull that too much, it's like turning your ankle too far. You get a sprained ankle and it gets painful. And the same thing happens on the bottom of your foot just from standing and walking, but mostly standing. Standing's much harder on your feet than walking is. And while we're talking about that, I think one of the things too that the older people need to do is walk. I think it's probably the best exercise we can have. Sometimes it's a little hard on feet, but I think that they have to try to take care of their feet so that they can keep walking and exercising. And so that, and then when you are walking, of course, you want to have a walking shoe, something that's comfortable and supportive and fits well.
Well, I'm sure that there's been so much material, reading material, available on shoes and the various types for walkers and joggers and runners and all of those, and I've wondered sometimes about them. A lot of those have a cushioning material on the bottom of the sole of the shoe, and I wondered. It seems to me now I have some that that I wear that they're not very dressy, of course, but they're very practical and very comfortable. And if my wife is going on a shopping expedition, why I generally try to make sure that I'm gonna wear a pair of those, because it's a lot of standing around and things of that nature. But I've wondered if that cushioning effect isn't helpful.
Yes, it is, and that's what the jogging shoe has, is the resilience that it has. That's why rubber heels are better than, or rubber soles are better than a hard heel. So we make contact when we walk on our heel, and then go to the front of our foot. Leather is still the best material as far as letting your foot slide some.
Mm-hmm.
You don't want it to stop too quick unless there's ice on the surface. But so a leather sole is the best, with a rubber heel in the shoe.
I noticed too that there's a lot of interest and material, so I assume there's a lot of interest in arch supports and things of this nature to supplement the fit of the shoe, and I wondered if you would like to comment a little bit on that sort of thing.
Yes. Well, we make or we send out to a laboratory to make, in some cases, supports. A support is about like glasses. They really have to be for your particular problem, for your particular shaped foot. So the supports we make, mainly, we cast the foot with plaster.
I see.
And we make a model of the foot, and then over this model is made a support. There are various materials we use. Today, probably the best that we use is a graphite material in a plastic. It has a lot of strength to it, yet it has some resilience to it. And then we make with other plastics and some softer materials too, depending on what the need is. But a lot of times, excuse me, a lot of times the surface we're walking on is flat and hard, and the bottom of our feet isn't flat.
Yes.
So what we have to do is have some material to support the foot, and that does normally take a fairly firm material, and that's when we come into the harder plastics. If we're trying to accommodate some problem, a pressure problem on the bottom of the foot, well, then we may go to a softer material.
I see.
And try to distribute the weight differently on the bottom of the foot. And these supports or appliances that we have slip into the shoe, and then you can slip them from one shoe to the other. So you can wear them in most any shoe, and they can even be made for higher heels. And
I see. I noticed too that some people have the shoe buildup. I suppose that is another alternative to a posture kind of a problem, and it would seem to me that something that you slip into the shoe and you can move it from one shoe to the other would be certainly more practical and more convenient if that resolves the problem.
Right. Yes, we try to always put whatever buildups we may want to put. We try to put them in the shoe rather than on the outside. Because the outside, every time you change shoes, you have to have the buildup put on, and the buildup wears down, or it may not be just quite right for your particular foot. So.
One of the things that I wanted to ask you about is the proper trimming of your toenails. That seems pretty mundane, but it seems to me with some people who have sensitive toes or hard toenails that it makes it kind of difficult for. Is there some magic, you know, people manicure their nails on their hands and usually take pretty good care of those, but I suspect that the toenail is probably much more neglected. When I think about it as far as I'm concerned, well, I'm sure that that's...
That's very true.
That's
Unfortunately, we kind of hide our feet, you know.
Yes, we do.
Our hands we don't hide. Well, as far as trimming toenails, the popular and common thing is to trim your nails straight across. The reason for that is that when people start trying to trim down the sides of their nails, they usually get into trouble. Now, a lot of times when a patient comes to us and we trim their nails, well, we trim down the side, and which is contrary to the trimming straight across. Straight across is the way to do it if your nails are normal nails. Normally, toenails are fairly flat, and a lot of the problems we get into is the fact that they change. They're not flat like they used to be. They're what we call curvated. They kind of dig down on the sides, and that gives a lot of pressure there, and sometimes the nails have to be trimmed away. But for an individual doing their own nails, they should try to, if possible, trim them straight across, file them, and not let them get too long. We see a lot of nails that are very long and very thick. And the longer the nail is, or the thicker the nail is, the more pressure you get on it, and then you're more apt to have problems. And of course, there are a lot of diseases you get in nails, and a lot of deformities you get in toenails too.
Yes.
And that is one of the things that we take care of most every day is nail deformities.
I would suspect so. I know in thinking of my own self personally, my toenails have changed a lot from what they once were, and part of that I would suspect is that my toes are getting out of shape, and so then the nail, the pressure from the shoe in walking tends to deform the nail, or at least that's what I've
see that the shape of the nail is determined by the shape of the bone at the tip of your toe, and normally that's flat, fairly flat. And what happens is bumps, and like I mentioned too before, was that we move our toes up against the shoe all the time, and over a period of years of doing that, why the bone reacts to the irritation by developing more bone, and so then it gets a little bump on it, and then that makes the nail more curved, or sitting up there to be bumped against. And if you irritate a nail over a long period of time, why the nail normally gets thicker.
I see.
I think that as we get older, our toenails get thicker and our hair gets thinner. So.
That's true. Dr. Tack, I think we're running out of time, and I want to thank you personally and in behalf of the viewers and the Commission on Aging for appearing on the program. And we hope that this is helpful to the viewers. It's certainly been helpful to me.
Well, I thank you for having
thank you again for taking your time out from a very busy schedule, I'm sure.
Thank you very much.
Thank you.